Monitoring an IV site infusion. The nurse is responsible for monitoring the infusion rate and the IV site. They are routinely done as part of the initial patient assessment and the beginning of a work shift. Assessment. Assess the current rate flow by timing the drops if it is gravity infusion or verifying their setting on the electronic infusion device. Assess fluid intake and output. Assess for a complication associated with IV infusion. Nursing diagnosis. Excess fluid volume, risk for infection, deficient fluid volume, risk for deficient fluid volume, risk for injury. Outcome identification and planning. The expected outcome to be met when monitoring the IV infusion site is that patient remain free from complication and demonstrate signs and symptoms of fluid balance. Evaluation. Achieved when the patient remain free of injury except at patient IV site, IV solution infusions at prescribed flow rate. Documentation. Document the type of IV solution as well as the infusion rate. Document the patient reaction to the IV therapy as well as the absence of subjective reports that she is not experiencing any pain or discomfort. Record on the intake and output document as needed. This ensures the correct IV solution, the rate of infusion, and our medication will be administered. Promotes safe administration of IV fluids and medication. Hand hygiene and PPE is prevent for microorganisms, spread of microorganisms. So identify the patient's issue, the right patient receive the intervention and help prevent errors. So good morning, sir. I will be your nurse today. So what is your name, sir? Okay. So I want to monitor your IV fluid or your. Okay. This ensures patient privacy. Observe the ensures that the infusion control device and the alarm are functioning. Lack of knowledge about alarm may create anxiety for patients. They ensure that flow rate is correct. Use a watch with the second hand for counting the drops and regulating a gravity-free IV infusion. Any kind of pressure on tubing may interfere with flow. Catheter may become dislodged from the vein, and the IV solution may flow into the subcutaneous tissue. Chemical irritation or mechanical trauma causes injury to the vein and can lead to the phlebitis. Phlebitis is the most common implication related to IV therapy. So, sir, there's any pain to your or this side?
No.
Okay. Poor aseptic technique may allow bacteria to enter the needle. Catheter insertion site tubing connection may occur with manipulation of equipment. Infusing too much IV solution results in increased volume of circulating fluid volume. Elderly patients are most at risk for this complication due to possible decrease in cardiac and or renal function. Bleeding may be caused by anticoagulant medication. Bleeding at the site is mostly likely to occur when the IV is discontinued. This facilitates patient cooperation and self-administration of IV solution. So, sir, call for the assistance or your if you noted for at the site or the IV container. So call for the assistance.
Yes.